Hi, this is Dr. Kurt Wohler. Let me talk to you a little bit about how to use supplements as a treatment for autism. Now, we know that many individuals on the autism spectrum have core issues with socialization problems, language problems, behavioral problems, stereotypical behavior, sensory issues, self-stimulatory behavior, etc. And there can be a number of ways to intervene, whether it's through behavioral therapy, speech therapy, occupational therapy, etc. There are a wide variety of supplements, obviously, that are used and available to help treat some of the core problems. And the way you many times have to decide what to use is certainly learn about what some of the different types of treatments are. I've created a website called autismsupplementscenter.com, and in this website you can actually research supplements by name. So if you're looking for a particular multivitamin or a specific amino acid like GABA or taurine or a probiotic, you can search for it that way. But you can also search for supplements as treatment groups or treatment categories. So let's say you're looking for supplements that are known to help with hyperactivity, or supplements that are known to help with attention and focusing issues. You can search for things on this website in that way as well. So it's important when you're looking at supplements to understand that many times supplements work synergistically with each other, which means that the more things you use, many times the accumulative effect you're going to have. And it's not always just about one supplement, but it's about doing a total nutritional program to really get the desired effect. So many of these supplements are capsulated. There are some liquids, and each kid's going to be a little bit different about what they'll tolerate. If you have a young child who can't swallow capsules, then many times you'll have to either open the contents of the capsules in juice or pear sauce, applesauce, some sort of food item to get them to take it. Kids who can swallow capsules, that's usually not a problem. They can easily swallow them. Some of the liquid supplements can easily be mixed many times in juices of various degrees, whether it's pineapple juice or mango juice, other citrus juices. So each supplement has its own unique effect on the body. So when I'm looking at supplement therapy, when I first start supplements, I'm looking just to kind of cover our bases, if you will. So I've seen many kids who have very limited diets. So the first thing I'm going to do is to try to fill in those holes nutritionally. Use a multivitamin, a multimineral, some type of antioxidant, maybe some zinc, some calcium, magnesium, just to add back nutrients that many kids aren't getting from a limited diet. And then from there, I'll look specifically at particular problems. If we have a child who has anxiety issues, then I may look to use something like GABA or taurine or something called theanine, which are all helpful remedies because they help influence calming in the brain. If I have a child who has attention and focusing problems, I might lean more towards something like methyl B12, which we know can help with attention, or DMG, what's called dimethylglycine, because it has a specific effect on the brain and helps to improve attention issues. If I have a child where I've either done testing or I'm suspicious they may have an underlying yeast problem, their behavior, they have goofiness, giddiness, silliness, a lot of inappropriate laughter, self-stimulatory behavior, which are all very characteristic of an underlying yeast problem, I'll look to implement some of the different types of anti-yeast natural remedies. Grapefruit seed extract, oregano oil, uva ursi, golden seal, something called allicin, which is actually an extract of garlic. All of these things are useful to help reduce the intestinal yeast problems that many kids have. And we know that intestinal yeast and the chemicals it produces can create problems neurologically. So when you're looking to do supplements, it's first and foremost important just to kind of cover your bases with a good nutritional program, and then start to analyze specific problems and start to use things specifically in those areas: hyperactivity, eye contact, attention, etc., things that I've discussed. So anyway, you can search this website and other information that I've created to inform yourself even more about supplement therapy. It's a learning process, but well worth your time in helping your child. Thanks.